Good morning. If everyone would please take a seat, we'll begin today's press conference and announcement. Thank you. I'm Stan Sitzer, and on behalf of the Northwest Autism Foundation, I'll be facilitating this morning's press conference. We would like to welcome children, parents, grandparents, and other family members of families affected by autism. Today we have some exciting news to share with you, and I'm going to run through how the press conference is going to work. We're going to be hearing from a number of representatives today. We'll hear from David Nelson, Senate Majority Leader of the Oregon State Legislature, from Gleason Eakin, Chairman of the Board for the Northwest Autism Foundation, from Steve Nicholson, co-founder and board member of Mercy Corps and also board member of Northwest Autism Foundation. We'll be hearing from Dr. Steve Edelson with the Autism Research Institute of San Diego, California, and representing also the Autism Society of Oregon. We'll be hearing from Dr. John Pangborn, representing Defeat Autism Now. We'll also be hearing from Drs. Harlan Winter, Dr. Tim Bowie, and Dr. Raphael Krushak with the Massachusetts General Hospital and Harvard Medical School, making our key announcement. Then we'll have some closing remarks from David Humphrey, representing Northwest Autism Foundation, and Richard Fay with the Fay Foundation, a major contributor to today's project. Then we will take some questions and answers from the floor, and then we'll go to one-on-one interviews, which I'll describe the breakout as we get to that point. We'll try to keep the first part of this to a half hour, and then go to those questions and answers. Ironically, it was the day before Thanksgiving, almost 3 years ago, when our youngest son was diagnosed with regressive autism. As a parent, when your child is ill, you want to find out what's wrong so you can fix it. Eventually, we were able to find doctors who could pinpoint the problem. But when they looked in their books to tell us how to fix it, the book said nothing could be done. Nothing could be done. 3 years after my son's diagnosis, and after hundreds of thousands of other diagnoses across the United States, and millions of children affected by autism around the world, isn't it time that we write a new book? What we are announcing today is the first chapter in that book, the first step in a new direction, the first leg in a journey that could result in a medical protocol for the treatment of autism. At this time, I'd like to introduce David Nelson, Senate Majority Leader of the Oregon State Legislature.
Thank you. I appreciate that, and I appreciate everybody being here today. This is really a momentous occasion because you're developing some funds and money to help push this cause forward. I'm here today representing the legislature because politics plays a great part in your life. Families with autistic children deal with reality every day. And what I'm here to do is to say there's a political reality also that you have to be very involved with. This is a cooperative venture between the state of Washington, state of Oregon, the Northwest Autism Foundation, many people throughout the United States. What you folks need to be is advocates for your cause. Come to the legislature. I mean, we can't solve all the problems, but you have to come and educate us. We have a grandchild with autism, so I have some background. But 89 other legislators maybe don't have that background. That's up to you to educate your legislator. Advocate for your cause. There's monies available. You're in direct competition with K through 12, community colleges, higher education, several, the Oregon Health Plan, prisons, state police, courts. You've got competition, but you also have a wonderful cause. So if I can leave any message with you, advocate and inform and educate. So you have my commitment from the Oregon Senate and probably from the legislature. Come and visit us, talk to your legislator, come and ask for some money.
Thank you, David. Now I'd like to introduce Gleason Ethan, Chairman of the Board of the Northwest Autism Foundation, and Steve Nicholson. Whoa. And somebody leaned on the light switch. Thank you very much.
I would like to assure David that we will be visiting him in Salem. "14 months ago, there was a happening in this building, and I will call it a happening now, where a group of people got together and discussed a vision. We walked away from here with a plan, and the plan is very, very, had I scripted that plan, it would have been no different than what's happening today. We met some physicians from Mass General who were treating autistic children. We're treating. They have, this morning, you'll see their plan to continue to treat children, but also share this with other people. And I don't know how many years away we are from being able to treat every child born with autism, every child that develops autism. It's just right here. So I would like to welcome you on behalf of Northwest Autism Foundation, and I would like to introduce Steve Nicholson, who's also a member of the board, who will make some comments.
Thank all of you for coming, and thank you for bringing the children. Their voices and their presence here, I think, is what we're all here for. And I simply want to point out that from the foundation, the Northwest Autism Foundation, from all of us on the platform here this morning, the one thing we're here about is creating a future. And I have always believed that the future is a created reality. It isn't predestined. We don't fold our hands and wait to see what happens. The future is the future we choose, the future we prefer. And we believe this morning we're gathered here in a very wonderful way that the intellectual resources, the resources needed to move forward and create a future for the children, to create a future for our communities, to create a future for the families that will be absolutely the future that is needed to cope with the problems of autism. And so just a few moments ago, I think it was probably symbolic that we had a moment of darkness in the whole room. And in the future, we're moving from darkness to light. We're moving toward the voices of the children in this room. We're going to create a future for all of the people in the world who need to know more about how to deal with this catastrophe. We welcome you. We welcome all of the folks on the platform because we believe that their preparation and their ability will turn the lights on for millions and millions of families. Thank you.
Steve. Now it's my pleasure to introduce Dr. Steve Edelson, Autism Research Institute, and also representing the Autism Society of Oregon.
I'm here as a representative of the Autism Society of Oregon. I'm the past president, currently a board member, and I'm also active in many autism-related organizations in Oregon and throughout the country. Now, the Autism Society provides support to families and professionals in Oregon. And the Autism Society has worked closely with the Northwest Autism Foundation on several projects, including the OASIS conferences. Now, we are witnessing a dramatic increase in the rate of autism in Oregon, which now has one of the highest rates in the nation. If you look at the charts here, you see the numbers are going up over the years. We are trying desperately hard to stop this trend and stop it as soon as possible, because if we don't do it now, what's going to happen in 5 years from now, and what's going to happen in 10 years from now will be more devastating than ever before. Now, parents and professionals in Oregon are thrilled that the Northwest is playing such an important role in supporting this biomedical research study, which will likely provide us with a much better understanding of autism, as well as ways to effectively treat these individuals. Now, I'm also here as a representative of the Autism Research Institute in San Diego, which is directed by Dr. Bernard Remland. Dr. Remland could not be here today, but he has written a statement of support. Stan Sitzer will be reading part of his letter in a few minutes. I should also mention that this statement will also be posted on the internet later today at www.autism.com, so it's going to be very easy to remember that internet address. In 1967, 35 years ago, Dr. Remland founded the Autism Research Institute with the contention that autism is an organic problem rather than due to the once popular but ridiculous idea that autism is caused by a mother's psychological emotional neglect. The Autism Research Institute is proud to announce a donation of $100,000 to help fund this Harvard Mass General study. And we strongly encourage other organizations as well as individuals throughout the country to support this very important project. I should mention that additional information about this research study and ways to donate money to the project will also be posted later today on autism.com. Lastly, Dr. John Pangborn has also conducted pioneering work on the biochemistry of autism and is one of the founders of the Defeat Autism Now movement. Dr. Pangborn, will you share with us some of your thoughts? Thank you.
Thank you, Steve, and hi, moms and dads. I'm also a dad of an autistic child, and it changed my life 35 years ago. Our son's 35, and he was born the same year that Dr. Remland established the Autism Research Institute in San Diego. About 7 years ago, in 1995, Dr. Remland and the Autism Research Institute, together with support from benefactors and moms and dads of autistic children, just like you, together with Dr. Sidney Baker of New Haven, Connecticut, and myself, established a movement called Defeat Autism Now. We had our first meeting in Dallas, Texas, and we invited 30 people, researchers and clinicians from around the world, to come and contribute their ideas on what they thought was going on in autism. At that time, the consensus was that there was a problem with maldigestion, that there was infections in the gut, that toxins were coming from the gut into the body, that there were false neurotransmitters in the brain, and that there was immune dysregulation. That much we had established, and that was the consensus in 1995. Since then, the DAN movement has chronicled, with consensus reports coming out periodically, the research of this loosely knit but large group of researchers and clinicians in autism. Today, we welcome and we congratulate the Harvard Massachusetts General Clinician and Research Team on the trail that they're going to embark on. They have no particular agenda. They are going to follow where the research takes them. We look forward to their clinical findings, but mostly we look forward to the modalities, the treatments, the methodologies that they will come up with to help us treat our children. Now, if Dan, Defeat Autism Now, could grow from 30 people in 1995 to over 1,000 meeting on the East Coast and West Coast each year, to 2,000 interested people getting together, think of what you can do for this project that we have starting today. Just think of what you can do to build this into a meaningful project that will develop medical treatment for your children. Thank you.
I have some excerpts from the letter that Dr. Edelson had mentioned from Bernard Remlin. This is a statement of support from Dr. Bernard Remlin, PhD, Director of the Autism Research Institute in San Diego, California. Dr. Remlin could not be here today, but he offered us this letter as a message for you here today. I'll read the following excerpts. The Harvard Mass General Medical Team has embarked on the third and by far the most promising leg of a journey that started 60 years ago in 1943, when Lee O'Connor published his classic paper on a new and rare clinical entity which he named early infantile autism. The 11 autistic children he described were unique among the over 20,000 children he had seen in several decades as a child psychiatrist. Now, as we all know, the formerly rare disorder has become an acknowledged epidemic. And I think the chart on the left shows that in Oregon, the 683% increase in the rate of autism in the last 11 years is truly an epidemic. Dr. Remlin continues with some missteps in the diagnosis and treatment of autism in the 1940s through the 1990s, and then concludes, as a parent and researcher who has been intensively involved with these matters for well over 4 decades, I am enormously heartened that the world-class scientists on the Harvard Mass General Medical Team are about to undertake this 5-year intensive investigation of what I and my colleagues in the world of autism have long believed to be the crux of the problem, the malfunctioning digestive system in autistic children. You might say the team is centering the attack on the belly of the beast we call autism. I am particularly pleased with the team's emphasis on treatment. This is what is needed. Go, team, go. And speaking of the team, it's my pleasure to introduce now Dr. Harlan Winter and Dr. Tim Bowie, pediatric gastroenterologists and associate professors at Harvard Medical School.
Good morning, my name is Tim Bowie, and I'm a pediatric gastroenterologist. I've been taking care of children with autism for the last 10 years, and I think that makes me somewhat unique among traditional gastrointestinal docs. I'm so grateful that you came today, and I'm so grateful that the Northwest Autism Foundation has supported our presence here today. Autism, as you've heard already this morning, is a condition that affects development, language, sociability in children who are in their developing years. And it's a condition that has a significant impact on us as a society. When the incidence was 2 per 10,000 when I started medical school in 1980, in the 1980s, and now we see an incidence of 1 in 500 children being affected, and some estimates, including Time Magazine, reporting an incidence of autism spectrum disorder as being 1 in 150 children. We have to wake up and we have to start looking for the cause. We know that this is a condition that has genetic links, and researchers who have done work in neurology and genetics are certainly doing very important work. It's work that needs to continue, but the genetics of autism do not fully explain the increase that we've seen in the last 20 years. And so it's spawned the idea that there may be other factors accounting for this increased incidence. And we don't know what those causes are yet. I think there's an awful lot of work that needs to be done in a lot of fields. Do environmental factors affect the genetic presentation of these conditions? And how does our gastrointestinal tract interact? We're not so sure yet. I've been fortunate at the Massachusetts General Hospital for Children, which is the largest Harvard Medical School medical provider, to work with a center called Ladders. Ladders is our neurodevelopmental program, and it is led by Margaret Bowman, who is the one of the premier neurological researchers in neuroanatomy with regard to autism. She welcomes a gastrointestinal doctor into her fold, and Ladders has a group of people, including geneticists, neurodevelopmental professionals, psychiatrists, speech and language professionals. And I think at this moment in time, we're the only autism center in the nation that has a gastrointestinal arm looking at the care of these children. We want to spread the information that we've learned from our own care and work so far to other centers, because I think that hasn't, the word isn't out about how to care for these children. And very often a parent, and there are many in the room, has been told, you have the unfortunate diagnosis of autism, go home, get yourself a speech and language professional, and here's the educational pathway to treat your child, without trying to look for other issues that might be accounting for why children don't perform well on the day-to-day basis. Do they have gastrointestinal pain? Do they have diarrhea? Do they have nutritional issues that are not being addressed? And if we address them, will those children improve? We've already started research in that regard, and some of our early findings suggest that a very large number of children do have gastrointestinal issues, and there will be literature in the next couple of years that suggests up to 50% and maybe more of the children on the autism spectrum have gastrointestinal disease. There's a very high incidence of food allergy in this group of children. Digestion issues are an issue. Inflammatory conditions in the bowel have been reported in very large numbers of children when investigated. And I say when investigated because so many children come to their traditional pediatrician and their traditional practitioner, and they don't get investigated because the traditional pediatricians out there haven't got the word that this is part of the story. And we hope to bring that forward with further work. I'd like to thank the support of the Northwest Autism Foundation and particular donors who are adding to that support, including the Autism Research Institute and Mr. Fade's Foundation. And we plan to, with the support that is being put forward here today, look at several specific aspects of gastrointestinal health. The work that we're looking at is primarily through some basic science research that Dr. Kushak will be performing, looking at intestinal digestion, protein digestion, and absorption issues that have been put forward on anecdotal experiences and on some very small-scale studies, but need large-scale evidence-based research to support the findings. That's our goal. That's what we plan to be doing in the next few years, and that's what Dr. Winter will be speaking about as I relinquish the podium to him. I'm grateful for your support, and thanks for having us here today.
Well, thank you very much, and it's a pleasure to be here. This is the first time I've spoken at a press conference, so if you will, I'm used to talking across the table to a family and children, so I think that we'll give this a go and see how it works, and hope it doesn't show up on television. My mother wouldn't appreciate it. I'm from California originally, and moved back to Boston to do my fellowship, but grew up in California, and I think one of the lessons that I learned in going to Berkeley in the 1960s was that people working together can accomplish a lot. And I think that that this alliance with the Northwest Autism Foundation is the first step in a new direction for all of us. Children need access to care. Parents need information about effective treatments. Investigators need to focus on ideas and develop new approaches to treatment. And finally, physicians, primary care providers, need evidence about how to care for children and their families who have autism. And this is really the mission of our project. It's a holistic approach to looking at research, education, and access, distribution of information. Sharing knowledge among professionals and among families is really key. The New York Times recently had an article where they stated that autism is not accepted as a medical condition. I think that those of us who look after children with autism and families who live with children that have autism know that this is not entirely the case, and that there are medical conditions that impact on children's lives. We may not have the knowledge currently to define those conditions, but we will someday. This project will really question that hypothesis, and will question the statement that this is not a medical condition. The initial phase of our project will build on ongoing studies that Dr. Kushak is doing in our laboratory, looking at the physiology of digestion, and a current area of much concern for children with autism. The support of the Northwest Autism Foundation will accelerate the acquisition of new knowledge about the relationship between the brain and the gastrointestinal tract. With additional support, we hope to fulfill the goals that I mentioned of children having access to care, parents having information, investigators focusing on new ideas, and physicians having evidence-based medicine to share with families. We will explore areas of treatment that are currently being used to better understand the mechanisms that will help evolve new treatments. Part of our vision is to create an infrastructure that will validate objective measures that can be used in clinical trials to assess outcome. This is critically important in autism. It's a lesson that was learned by the Cystic Fibrosis Foundation, by the families who had children with leukemia, and by establishing objective measures and assessing outcomes, we can develop evidence-based medicine that we can learn from and accept and help patients through that process. By developing a body of evidence-based medicine, we can begin the process of educating physicians about how to care for children with autism. There is a great need in our society to educate physicians about caring for children with autism. The resources at Mass General Hospital, the Ladders program in the Harvard Medical School, in conjunction with the support from the Northwest Autism Foundation, and not just the support, but I think also the vision that the leadership of this organization has in how to approach this problem. We'll form an alliance that will accelerate our measured approach to new knowledge. We want to partner with families, investigators, and physicians who develop this evidence-based approach for caring for children with autism, to bring new investigators so that knowledge flows from the bedside to the bench and from the bench to the bedside. We also hope to create educational programs so that parents and healthcare professionals are empowered with the knowledge that they need to make decisions about the unique and special needs of children with autism. Dr. Kushak, Dr. Bowie, and I are excited about the opportunities that are ahead and believe that the totality of the project is larger than the sum of each of the components. Ladders, Mass General, Harvard Medical School, and the Northwest Autism Foundation. Working together, evaluating new ideas, keeping an open mind, and always remembering that our goal is to improve the lives of children with autism. Knowledge empowers us to accomplish this goal. This is the first step of a journey that we will all need to make together if we're going to be successful. Let's make this journey together. Thank you very much.
Thank you, Doctor. Well, this morning you've learned who is involved, you've learned what the opportunities are, and now for a few remarks about how you can help, I'd like to introduce David Humphrey, representing the Northwest Autism Foundation.
Wow. I'm proud this is happening in Oregon. It's where it should happen. People are in this room primarily are here not because of an academic concern about the rise in autism. People are here in this room because they have a child that affects their lives. So what we're going to talk about today is how this can affect parents and their children. The reason that we supported this project is because Dr. Bowie is treating children with autism, has treated over 600, and I've talked to many parents that have gone to see him and their children's lives have been significantly improved. And by doing over 600 endoscopies, he has biopsies at Harvard Medical School, Mass General Hospital, which will be able to prove and categorize the extent of some of the disease in the gut, and that will start to change things and develop medical protocols so that all children have access to medical care that they need and they deserve.
Yeah.
So let me explain the mechanics of it. We start here with the first phase, which is $450,000. That $450,000 allows them to take these biopsies and categorize and do the research and find how specifically to go ahead and improve the treatment that they're already doing and let others know those results so that those results can be widely known and accepted. So that article that we talked about in the New York Times says autism is a condition that has a strong medical component and help is on the way. That's what we want to accomplish, and that's what they can accomplish on this first phase. The second phase, the one, and we've raised all the money for that. The whole $450,000, yes, has been raised. So that's done. The second part, the longer part, the part that we have the vision on, is that they will establish the medical protocol and bring that out to 5 centers across the United States to begin the treatment and pool this information into a common database that the American Medical Association and others can start building treatment for the average pediatrician to know exactly how to care for your child when you walk in the office and have that covered by insurance. That's where we're heading on this project, and we're going to get there. We're going to get there. All of the money has been raised from parents and parent-based organizations. This means that the constituency of the funding comes from you. This means the responsibility for the outcome comes to you, and they're real comfortable with that because these are great guys. The vision of Dr. Rimland and talking about this as the third and most important stage is what we also believe the Northwest Autism Foundation, and we support that. So what you can do is, let's start raising this money, let's start making this thing happen. I am very privileged in my lifetime to be associated with this wonderful cause and wonderful parents. And we told you, bring your children, because that's what it's about. We want them here on this historic occasion, and thank you for bringing your children today. We were not at $450,000 2 weeks ago. We were a lot short of that, so this press conference is going to be a lot different. And I got a call, and I get a lot of telephone calls that are very emotional for me, but this one definitely ranks in the top 2 or 3. Richard Fade from the Fade Foundation called up and said, what do you need to make this $450,000, and I'll put the rest of it in. The Fade Foundation has had a great generosity. Richard and Susan are parents of a child with autism that is recovering. Richard Fade did not want to be identified. He did not want to sit on the program because that's the kind of guy he is. And we asked him, please, please come and say a few words to you. I'd like to introduce to you Richard Fade, recently the Senior Vice President of Microsoft, and a swell guy.
Well, you can see how effective I was with Dave. I'd like to thank the team from the Massachusetts General Hospital and the Northwest Autism Foundation for giving us an opportunity to support this important work. And at least I sound like a Mutual Admiration Society. I'd like to also recognize Dave Thomas. I'm sorry. I'd also like to recognize Dave Humphrey for his work, because frankly, if it weren't for Dave, we wouldn't be here. I'd like to give him a hand. Dave has been a tireless worker. He's been at the center of this. I think you heard his passion in his comments. He made this happen. It's late in the event. I'll be mercifully short in my comments. You know, I would like to recognize there are a lot of dedicated researchers in the world looking at autism. And there are a lot of very, very dedicated therapists and people, professionals engaged in behavioral and educational services for children with autism. They work with my child, and they work with many children in this room. The thing that was so exciting for Susan and I in this opportunity was it was a chance to help establish research that would look more broadly at the health issues of children with autism. There are thousands of families in this country who today are practicing treatments which seem to be helping their children get better, but those treatments aren't accepted broadly in the medical and well communicated in the established medical community. When those pediatricians and physicians went to med school, they weren't taught about these things. They didn't receive any background or information about that. This project is an opportunity to enhance that learning and specifically to produce a set of clinical interventions that your pediatrician and physician can then take and help your child. Instead of having the situation we have today where we are polarized by those who are fearful to practice something that they don't understand and that hasn't been substantiated by some peer review or well-established science and medical research, and their genuine desire to want to help our children. So we couldn't be more excited about this project. You know, autism has grown tremendously, as this chart indicates. It's now more prevalent than Down syndrome, childhood deafness, and childhood cancer. We need to get the word out to the rest of our society that this is the case, because I think very few people realize that. Those of you in the medical community who will listen or hear this message today, I ask you to take an open mind and to learn what you can about the research that comes out of this fine team in Massachusetts. And those of you who are families and individuals who have the capacity to give to this effort, I ask you to dig deep and help produce the funding for the next several years' worth of research. We've got the stake to get started, but this team is going to need funding for several years to come, and I urge you all to mobilize your friends, your family, and those that can help this cause, because I think it's truly a great beginning. Thank you very, very much.
Right now, we're going to open it up to question and answers from the media, from the audience, so that everyone can hear. I'll repeat the question, and then we'll have the person who'd like to answer the question come up to the podium to answer the question. So if we have any questions for the media, we'll do a few questions and answers, then we're going to break it down into some one-on-one interviews. Question here?
Well, I'm not media, but I'd like the people in this room to acknowledge the presence of a research MD and a magnificent child psychiatrist who recently retired from Oregon Health Sciences University. This is our Dr. Canner. This is our Dr. Hans Osberg. I'd like to all of us give special notice to Dr. E.T. Stubbs.
Any other questions for the presenters? Over there.
I'd like to acknowledge John Green and his great sacrifice.
Any other tributes or questions? Yes. The question is, will the GFCF diet be included in this research? Dr. Bowie.
The gluten-free and casein-free diet is a dietary intervention that many people have tried. In fact, a lot of the digestion work that we're going to be looking at is very specifically trying to answer the reason for why a gluten-free or casein-free diet may work. We're not sure why that is. There are several ideas, whether these are foods that cause allergies, and we think that may be true, or whether there's a digestion error in breaking down those food products, and that creates problems. And that is actually the crux of several of the experiments that we've proposed as part of this project. And as we progress, we will be looking specifically at dietary intervention to see if that helps.
Any other questions from the floor of the audience? Yes, in the back.
This isn't about diet, but I have a 10-year-old grandson I'm raising who's autistic, very high functioning, but we found the chemist to take him to most of them wouldn't deal with him, and he has a complete mouth full of silver caps covering every tube in his head is covered. He also, I stopped his immunizations because that's when the trouble started, and he has definitely changed since we quit letting him have immunizations. I want to know what your input is on fillings and caps on their teeth and the immunization issue. I know that's not exciting.
The question is looking for an opinion on silver fillings in the mouth and immunizations as it relates to this topic.
As a caregiver in this field, I have hundreds and hundreds of questions. I think this is an important question. There are researchers who are addressing those questions. Some work that we're doing independent of this project is looking at vaccine injury, etc. Today we're here to talk about this project, and this is really regarding digestion and absorption and the gastrointestinal health of these children. So I'm happy to speak to my opinions offline, but I think that's not part of what this project is going to be looking at.
One last question, and then we'll go to individual Q&A. Yes, go ahead.
The study and the research that you will be performing, are you going to be using population-based in this area? Or where
Good question. For population base for this study, will that be from this area or other areas? Dr. Winter?
Well, thank you for helping us. This project, the focus, the initial part of this process will begin at Ladders, where there is already an established program for treating children with autism that encompasses a multidisciplinary approach to the problem. It's our hope and our plan that we will be able to establish, and we intend to establish, links with centers in the Northwest, in California, and other areas where we can begin to interact with investigators in those sites so that we can share information and broaden the experience. The goal of this is to empower people with knowledge, and those people include families, physicians, and investigators. So our goal is to expand this and to work together on this effort. The question is, how will families from children in Oregon be part of this project? I think that this project is the beginning of this project, and if you say, how are families in Oregon going to be involved in the next month? This is beginning in the laboratory with some questions that we're going to answer. But as we evolve and develop resources to expand this project, we hope that there will be providers in Oregon who will work with us to develop a network of centers that begin to look at this problem together, so that children in Oregon will be evaluated with the same tools that children in Boston, or children in Seattle, or children in California are evaluated. And this network of investigators will then work together with families to understand and interpret that information. So, I see this as the beginning of a process that will evolve to include families, hopefully throughout the country, because the goal is for all children to have access to these kinds of resources and care and better understanding for this disease.
And when do you think that would happen? Is this in 5 years, in 10 years? What's the goal right now?
You're actually asking about a timetable for when this is going to happen. This first phase, the vision that we put together is a 5-year proposal. So over the next 5 years, if we're able to get support to carry this forward, we plan to look at outcome measures, to look at testing some of the hypotheses about digestion and absorption, and to begin to have educational programs, think tanks that will be able to address areas in need of new knowledge. So this is the 5-year plan for the first part. Beyond that, I think there are clearly other areas that will become obvious that will need to be explored. And as somebody said earlier, the science is going to drive this. We don't have an agenda with this project. The purpose of this project is to be able to interpret the data and then move based on what we observe, what we find. So that's our plan.
And will this study finally allow families to have health insurance pay for some of their doctor's visits, or some of their, the cost of changing diets? Will this finally help them get the medical coverage that they've been denied?
The question is whether this project will help families with insurance coverage for treatments for which they've been denied compensation. That's an important area, and as all of you know, that the process of reimbursement and the process of how this occurs requires advocacy, and it's a partnership between families and professionals. And I think that this project is going to help build that alliance so that families and professionals can begin to work together and take evidence-based medicine and go to providers and say, there, we have evidence that this treatment works or this treatment is of benefit to children with autism, and then it's a matter of advocating for that to happen. It doesn't happen overnight, but I think that's why I said this is a journey that we need to make together. And I think that the steps that we're trying to take now is that there are a lot of people in this room who have been involved with this for a long time and understand this process, and we want to all work together for the common goal of improving the lives of children with autism. So I'm not answering your question directly, but I'm saying that I think that this process will evolve into advocacy and support for advocacy that can change those things.